Well, I would say that I would like to thank Own Your Growth for having me on board. And I would say Own Your Growth is doing a very wonderful job by inviting people and letting them share their thoughts and making people aware of it. Before going on to my topic, I would say that there is a stigma in India that people won't go for a therapy. They feel like therapy is like that makes people that makes one weak, but it's not like that. I would say, it's like whenever a person is having mental health crisis, it cannot be okay with a paracetamol or Crossing, right? And we think that if anyone talks about mental health or having depression or anxiety, he or she would be friends would be saying that why don't you have a crossing or why don't you go for a solo trip? You might be get fine. But no, it's like asking that person that how is it feeling, how the person is feeling, what all is he going through. Because talk and sharing things can get a person on track, I would say. He would be able to vent out on with someone. So yeah, and I would say that recently the COVID has hit us, and many people got to know about the importance of mental health because many people were going through such a difficult time. Like they were having anxiety, they were having that hallucinations. Like, what if the other person died? What if my loved one died the next day? And people were getting fired from the job itself, right? So it's like one at that moment of time one got very scared, right? And it's like no one was helpful at that time because no one was able to listen. We cannot handle this situation, we cannot handle other person's opinions, but at the end one feel like the opinions, the thoughts, and they should be listened, right? They should be one should listen that. So presenting with my document here, I would say I have the topic for today is psychotherapy. So psychotherapy itself says that whether it's like we don't have to sit passively in front of a doctor as we do in our physical health, right? We don't have to do that, but in the psychotherapy, in case of mental health, we have to sit in front of a person who will be guiding us. We have to bend out. A person has to talk about their triggers, about whatever is getting, whatever person is going through. In the second point, it's all said that whether it's called a talk therapy, a counseling, or a therapy, psychotherapy is a process focused on helping you to heal by more constructive way of handling those problems or issues in your life. Like one can talk about the problems, one can talk about what is getting through, what or through, and a psychotherapy is like one can get a way, a clarity to heal a person, right? And getting therapy can also enhance the support system when going through a difficult time or when you are in increased stress. So yes, it's like when a person has to start a new career, or a kid has to go to a school, but but that kid is feeling very overwhelming that I don't have to go, I don't feel like going, I just want to sit at home. So also parents would be thinking that something is wrong with the child. So then then the parents also might seek a therapy for it. That what is triggering the child? Why does he don't want to go to the school? So, and getting through the divorce, getting separated in a relationship, or dealing with other issues, it's like when two person get apart, whatever the reason may be, it can be anything. We are not, I don't know what it can be, but yes, whenever they are going through it, it can be very overwhelming for the person. It would be like, what next? What I will have to do the next? But but with psychotherapy, a person get a clarity with it, and a person would get to know that how to take things now from the scratch. Indeed, a person has to start it from the scratch. So yeah, mental illness is often treated with psychotherapy alone or in combination with medications. Yes, sometimes the condition might be severe for a person. It might be severe anxiety or severe depression or anything. But and for that, a person has to undergo medications that can improve a person's health, mental health, and also with the help of psychotherapy, a person would get help, assistance with it, right? And as the name implies, the word psychotherapy also it actually psychotherapy is not only a therapy. It's a vast number of different treatments. It's not only one. There are many of the treatments in psychotherapy listed. So in an individual with a mental illness works with a mental health care professional who helps him or her to identify and work through the factors that may trigger the illness. Yes, they have to work with a mental health professional. They work with them and they try to, they went out in front of them. They talk about their problems. And the psychotherapist will also try to analyze that what are the triggers that has caused the God that has been like the situation has arise that a person has to seek a therapy. So what are the all are the triggers with that? So yes, a person has to go with a mental health care professional who would guide a person, who would assist a person with their problems to overcome them. Next, we have myths about psychotherapy. There are a number of misconceptions and misunderstandings in the case of psychotherapy. Uh, we have few of them listed here. It is the only rich one who can afford therapy. Like whoever is having a mental health crisis, whoever is feeling depressed or uh, way too level of anxiety has to seek a therapy. It's not the thing like it's only the illness of white people. No, it's not because any of the person, regardless of the caste, color, creed, anything, or on the basis of sexuality, I guess anyone can have a mental health crisis and they can seek a therapy. It's not only the rich one who has to seek therapy. Psychotherapy is ineffective. No, it is said that when a person just went out in front of someone, in a front of a psychotherapist, he feels relaxed at that moment of time. That yes, I have now vented out. I have told my all the problems, and I would be getting some sort of assistant by the professional. I would be getting some guide. I would be getting some sort of clarity with it, and I would also start my life from the scratch again. So therapists can read minds. I would say this is the biggest conception anyone says. No, therapists cannot read minds, but yes, they can analyze a person, what is going on, what is triggering a person, and what all are the problems that a person is handling at that time. So people who seek therapy are insane or weak. The truth, I would say that person who seeks therapy are strong enough and have the guts to go to the therapist and ask for help because most of the people do not do that because they feel that people would judge them or they feel that people would say that you are very weak. Why do you have a therapy? Just take it on your own or handle it on your own. So there are so it can happen here. This is the misconception here. The therapist and the client become long life friends. No, there are some of the boundaries between a client and a therapist. It's like when a therapist just sees a client, there is a boundary between. Yes, a client might be saying that she is like a therapist is my friend because a client is uh, venting out all the problems in front of her and might feel that he or she is my friend, but it's not like that. There are some boundaries, some professional boundaries, I would say, and they have to maintain it. Psychotherapy has ready-made solutions for all the life problems. See, it depends on the person's problem. Every person will be having different problems. Like If each and like we people are very different, and we have different lifestyles, we have different choices, decisions, problems, everything is different. So are the solutions for the problems, they are very different. One has anxiety because of constant overthinking, and one is being depressed because of stress, because of office work. So there are different problems, and obviously the solutions would be different in the psychotherapy. Next, we have the need of psychotherapy. So, what are the needs here of the psychotherapy? We have psychotherapy may seem a daunting prospect due to many misconceptions about it. You may feel nervous about trying it, regardless of what you know the truth or not. So yes, it's feel like when we have seen much of the misconceptions previously, and people feel like it's not ineffective, it's not so valuable, or it's not being so beneficial for us. And they also might be knowing the truth. They might be also knowing the truth that yes, may get signed with it maybe, but the misconception has already trapped them. The misconception has been like trap their minds that no, maybe or maybe not, it can be fine. So, yeah, it's worth to overcome the nervousness. Anytime your quality of life isn't what you want it to be, psychotherapy can help. Yes, overcoming a problem or a nervousness while going to a psychotherapy is it's worth it, because psychotherapy is very ineffective and can be like, and it's, I would say mental health is more important in it while going to a psychotherapy, and while going for while getting to know the person, while getting to know the triggers and the problem you'll be talking about in front of a psychotherapist. Therapy may be sought by people who have felt depressed, anxious, or angry for a very quite long time now. So yes, it may be like who has been depressed, who has been feeling not feeling very bad, or feeling not comfortable, or is being constantly overthinking and being worrying about problems. It can be good. I would say it can be very beneficial for these, and for the people who are very agitated also, because angriness, I would say it's also a very dangerous for oneself also, and for the other person as well. Others might seek assistance navigating short-term issues, like someone is going through a separation, grieving from a loss, or yeah, and feeling overwhelmed by a new job. It can be like we sometimes need assistance. We need a guidance what we have to do next in our life. Someone might be going through a separation in their life. They might be like, what do I have to do next? What if I cannot handle the situation? What if I would not be cope up with the things again how it used to be? It might be very difficult for it. So, and also grieving with the loss of one has if one has lost a loved one, it would be very, very overwhelming for that person as well to cope up with the situation, and after that, and living without that person, and getting to know how to cope up with the you things post losing a loved one, and feeling overwhelmed by a new job. Sometimes we say that the things we want cannot happen, and that's the true truth, I would say, because what we want doesn't happen actually. Because work stress is common these days. People have to work, I would say, 12 hours a day, or maybe 13 hours a day, and that actually is very stressful, because they do not get their time, they do not get their me time, they do not get to socialize with people, and that can take a toll on their mind, and if talked, and with this psychotherapy can help with them. So yeah. Next, we have psychotherapy goals. A client can benefit from psychotherapy if they're experienced troubled thoughts, troubled emotions, troubled behavior, interpersonal and life issues, and biomedical difficulties. So yes, a person having thoughts like intrusive thoughts can be there. We have if a person is having constantly overthinking about something or worrying about career or anything can be there. Troubled emotions like having breakdowns, constantly crying, constantly being angry on someone without any reason. Troubled behavior, it can be it, trouble behavior. It can be like not socializing much or not trying to go out of people, just acting weirdly, not talking to anybody, and just being isolated in a home, in a room, or in anywhere else, whatever the place is comfortable for the person. We have interpersonal and life issues. It can be like we have life issues. We have to sort that issues as well. But when those issues just take a deep toll on our mind, when they are not controllable, when they are not when a person is not able to control that emotions, that feelings, so it can be kind of very overwhelming for a person, and it can be, and psychotherapy can help with that. Next, we have biomedical difficulties, like a person going through medical issues, like a person going through cancer, and he might be thinking that now I don't have any chance to live. He might be constantly overthinking about it. He might be constantly getting constantly being anxious about the same. So yes, it can. For that, psychotherapy can help with it. Next, we have signs that need therapy. What are the signs that a person has to need therapy sessions? So we have an individual problem doesn't seem to improve despite the family, despite the help of family and friends. So they think that family and friends are everything for us, and indeed that is correct. But when the individual who is suffering from a mental health crisis, he would be thinking, I am not. I guess I'm the solution I want. I am not getting by these people. I have to see someone else who would be giving me a relevant and much meaningful solution for my problems. A person cannot be able to concentrate on work, assignments, or complete all other daily activities. It's very hard at that moment of time when a person having these sort of crisis uh, to complete the task, to concentrate on work, to be on the laptop, to concentrate on any of the tasks, be it household or official or professional, I would say, and on daily activities. Like it get hard sometimes to get out of the bed and go to have the water as well. The things are so difficult at that moment of time. A person constantly worrying about the worst possible outcomes, as they are always on edge to guess. The people think, see, a person might be thinking about being negative about the problem, that this would definitely help. This would definitely be wrong. This would definitely, I won't be able to crack it when a person is in exam, I would say. I would get it very wrong, and I won't be able to clear it. I don't know, I might die the next day if a person is very ill. So the next is alcoholism, drug use, and aggression are all the harmful behavior for a person and others as well. Yes, alcohol is excessive of anything a very can lead to a very bad path, I would say. And as like we have alcohol, drugs, and these can actually destroy a person's life. Aggression is, as I mentioned before, it's very very harmful for one and also for the other person, because a person might be not knowing that what would that person do while being in aggression, and after that the person has done it, he might also regret that what did I do, and afterwards it's just all done, and the person cannot help with that. So yeah. So, what is the main thing to know about the psychotherapist? What all has a client when a person who is going for a therapy, what all he has to know about the psychotherapist? So, a person has to know that whether a his psychologist or a psychotherapist has that expertise in the particular area, or whether that person can help you with overcoming the problem, or with guiding you with the problem, and can assist you with the better solutions of the problem. A person needs to have a better expertise in the same field, because we might have many of the cases are there that they are not certified in psychotherapy, or they are not mm, or the certifications are not up to the mark, or there are many fake cases for that as well. So next on we go to analyzing the effectiveness of psychotherapy. So we have some people wonder why they cannot just talk to their family members or family about their problems. Psychologists provide more than a place for a person to vent. They have extensive training and experience that can help improve their lives. Yes, they feel a person would be feeling that why I'm not able to just vent in front of my family and friends. They are just my closest. But sometimes a person cannot help with that. A person has to seek a psychotherapist, and they actually provide a much place to for a person to vent out. They are not judgmental. Firstly, they won't judge that why is it happening. They would rather be be very kind to you, that how can it be happening. They have to be more empathetic towards the person who is having crisis, and they're having training and experience in the same field that can improve one's life. And also, there is a substantial evidence that shows psychotherapy to be an extremely effective treatment. Yes, there is an evidence by this that psychotherapy has been an effective treatment. It's very effective, as one can be seeing there are changes one can see after psychotherapy, because they actually get clarity with it, that what they have to do the next, right? Next, we have engaging in psychotherapy. So during psychotherapy treatment, you will be undergoing talk therapy. Like you will be talking to a psychotherapist. You will be telling your problems, your triggers, your situation to a psychotherapist. And during the consultation, your psychologist or a psychotherapist, you both would be discussing that how to resolve or overcome the problem, and what will be the key points to overcome that, or what will be the key points to get to the normal phase again. So next we have is psychotherapy worth it? Like unlike we have a medical or dental treatment where patients has to sit passively while professionals work on them, describe their diagnosis and the treatment plans, psychotherapy actually needs active participation. Like we go to a dental treatment, we go for a physical treatment, like when we are not fine, we are having troubles with our physical health, we just go there, we just talk to our problem, and the doctor gives the diagnosis to us, but and treatment plans and what we have to do the next. But in case of psychotherapy, two people have to work together. A client has to speak up with it. A client has to give his or active participation while going to a psychotherapy. Like there is no point actually if the psychotherapist has to do much of the work. Like if you're getting therapy, you have to a person has to make sure that you would be getting involved in much of the you have to get involved in much of the talks. You have to tell about all of the problems you don't. It's like it's sort of a participation thing. It's sort of one cannot do anything. Not only one has to do the whole task. It's not about a physical health. It's about a mental health over here. So Psychologists do not have to be like spoon feeding you that you have to do this for tomorrow or that for tomorrow, and one has to be getting to know that as well. And the third I have already explained is your psychologist have to, and you have to work actively, because yeah, active participation will be beneficial for a client and a psychotherapist, because a client would be getting a clarity and a psychotherapist would be getting to know the reason behind the triggers and everything. So yeah, we have next, how effective is psychotherapy? Like, we have studies shown that the psychotherapy has given positive difference in a person's life. He has been overcoming the problems and able to start from the scratch again. Based on the reviews of the studies, it appears that about 75% of the people who participate in psychotherapy benefit from it. And according to their studies, 80% of the who have undergone psychotherapy are better off by the end of the treatment who do not receive it. Yes, it's like there are many patients, as I mentioned, 80 to 85% of the people in India are just suffering suffering mental health crisis, and and some of them are actually going for treatment, right? And they have, and it's been shown that psychotherapy has given much improvement to their lives, much effectiveness to their lives. So yes, it's 80% of the people are showing better results than the people who haven't gone to the therapy till yet. So we have this tips for starting the therapy. Say before going to the therapy, what all the points a person needs to remember. First is, together with your therapist, establish some goals when you begin. Afterwards, spend time reviewing your progress with the therapist and regular intervals. Like, one has to be set in their mind. One has to uh, be prepared that what are the goals that a person would have to do or would have to receive while going to a therapy. And also, after one or two sessions, just try to analyze your progress, that how much have you improved, how much have you been trying to cope up with the things, right? If you do not like your therapist approach, you don't believe that therapist helping, you can ask for the second option if both agree. However, do not stop the therapy. Yes, there are the situations like that you might not like the therapist approach, you might not like the therapist, how it's treating you, how it's going with you. And also, if you don't believe that the therapist is not helping you in any of the ways, just it's your time, wasting time. But you can go for another option. You can seek another therapist. But yes, do not try to stop therapy abruptly, because it can be much. Like, the schedule can might be much disturbed at that moment of time. And next is, don't hesitate to ask questions. Yes, one has not. If a person is going to a therapy, he has all the rights to ask the questions, whether they can be any of the questions, because you are not only to listen, you are also to speak, and you have the right to ask the questions. So we have the next, focus on the fact that your counselor is there to help you. Oh, sometimes a person might be thinking that the therapist also might be judging you, or might not be giving you some good solutions. But it takes time, right? And also, your counselor is there to help you. It will definitely take time. It's a process after all, and you have to believe your counselor that he or she is there to help you, and will definitely will try to overcome your problem. And as I mentioned before, only for the last point, practice patience. Patience is very important, because one who is having patience can reach all the goals. And therapy is not about only having decided in the first initially that I will only take 3 sessions and I would be fine, or I'll only take 2 or 4 sessions, I would be fine. It's a process. It's a very slow process. It's not like a hard and fast rule that this after this intervention of the therapy you would be getting fine. It maybe there would be time that a person might see results in a very short period of time, or maybe in a very long period of time. So it depends on the person to person, and one has to understand that it's a process and things take time. The therapy would take time, and the things would take time to overcome again and to resolve. We have then how therapy might be beneficial to you. We have mental health is affected by a person's thought, feelings, and other circumstances. Self-defeating thoughts, for instance, can make a depression worse. Yes. Alternatively, a person might feel anxious around specific people or places during psychotherapy. A therapist can help the person avoid these triggers and learn new coping mechanisms. Yes, it's like a person constantly was worrying about the things, constantly overthinking about things, being negative about it. So it can make a person's condition worse, right? And it's like and it would be like it would be very difficult for a person to avoid that. To would be very feeling, it would be a person would be feeling very anxious at that moment of time, and a therapist can help a person avoid these triggers and to learn all the coping mechanisms which are involved in this process. We have then, in addition to these, helping people understand how certain events contribute to mental illness. It's also helps them to better grasp the way in which events can affect their lives. For example, if you change job, get ill, lose a loved one, or experience any other change, you might not even realize it. Situational depression and anxiety can help from these factors. A psychotherapist can suggest a solution to your problems and assist you moving forward. Like situational depression, like I mentioned, when a person is having a very overwhelming job and is not able to cope up with the stress, or is just being swamped up with the work and not able to socialize. That I would say that is a very situation, because it's like office. This the thing, the trouble a person is getting is the work, the office, and it's not a person is not able to cope up. So with that, a psychotherapist can help the person to cope up with this as well. Then we have your mental health can be improved with the help of psychotherapists. Yes, it definitely can be, because they are there to help the people who are suffering from a mental health crisis. And you may be able to experience life differently and witness the emotions with the capacity to deal with them as they surface in various situations. Various scientific techniques can help you deal with stress, trauma in your way of thinking, or as well as life skills in case of problem solving, positivity, or overall efficiency. Not only a psychotherapist just go for treating disorders like anxiety or depression or OCD or like that, but it also give you the assistance like how to deal with the trauma. It can be any of the childhood trauma, or it can be uh, any other thing, like if it can be stress due to exams or due to an overwhelming job, or and psychotherapist can give you a better clarity or better clear vision on that how you have to give your how to you have to overcome with it, right? So last I would be saying the goal of the therapy is to help you lead a life that is meaningful and focused on what you have valued the most, so you can feel more confident and have a stronger sense of self-esteem. Yes, because the main goal of the therapy is to help a person to overcome the problem and try to lead that normal life again, try to lead a meaningful life again, and be focused on the task the person is doing. And one can be more confident about the things a person wants at that moment of time. And I would say that it makes a person more stronger, and the self-esteem is actually built up with that. So we have the last is the goal of therapy is not merely to help you feel better, it's also help you to live better. Yes, it's not only the goal of the psychotherapist that you will be feeling better. you will be feeling better after a few times. Like you will be feeling, will be having a clear vision about your life. But also, with that, you'll be having a clear vision how to live. You will be able to live better with that. So I would say one whoever is having a mental health crisis should definitely go for a therapy, because that can give you a clear vision of your problem, or clear vision how to overcome it. And I would say that please, this is not a shame. Mental health crisis is not a shame. Going to therapy is not a thing that a person would be feeling that you are weak or you are insane. No, you are not crazy or you're not insane. You are, I would say, you are very strong enough to overcome your problem. You are very strong enough to ask for the therapy. So that's all for today, and I will thankful again for Onya Pro to giving me this opportunity. Thank you so much.